Hello and welcome back to Curry Soup. Today we're going to be talking about something very important, preeclampsia. Preeclampsia is a condition which affects only pregnant women, and the only cure for preeclampsia is delivering the baby. The reason I chose this topic is because preeclampsia is super dangerous. If not managed properly, it could cause complication to the mother and the baby to the point where it could lead up to death. For the mother, if it's not controlled properly, preeclampsia could evolve into eclampsia, which basically means a pregnant woman having seizure. And for the fetus means baby in the womb. The blood supply to the fetus could be limited to the point where the baby has brain damage, growth retardation, and oftentimes premature delivery. So, without wasting any more time, let's get straight into it. Preeclampsia is a vascular disorder. That means problems with your blood vessels. And it's characterized by two main symptoms: high blood pressure and proteinuria, which means presence of protein in your urine. Preeclampsia is a disorder which happens usually after 20 weeks of pregnancy. What if you had hypertension before that? If you had hypertension before that, we usually call it chronic hypertension. HPT means hypertension, yeah, just for short form. And if you never had hypertension before and immediately after you got pregnant you suddenly have hypertension, it's called gestational hypertension. But after the 20-week mark, if you have hypertension and they do a urine test on you and they find protein in the urine, it's usually called preeclampsia. And if you're someone who already has hypertension before you got pregnant, it's called chronic hypertension superimposed with preeclampsia. So how does preeclampsia happen? There are many theories to it. So let me explain one which I hope you could understand the best. When a baby is just formed, when it's really tiny, when there's only few cells there, certain changes happen in the body. One of it is the body will move to develop a temporary organ called a placenta. A placenta, it's like a gateway between mother and the baby, so that the baby will get enough nutrients, oxygen, and everything it needs to grow. In order for this placenta to develop, certain things happen. The main event which occurs is something called trophoblastic invasion of spiral arteries. Spiral arteries are arteries which are present in the uterus. What the baby does is, in this case I'm using baby so it's easier to understand, yeah? It'll start invading the mother's uterus so that it could penetrate into this spiral artery so that a connection is formed. In very rare cases, this connection is incomplete. When the connection is incomplete, that means the gateway is not properly formed. That means the nutrients from the mother to the baby is not gonna come in properly. This is something called placental hypoperfusion. Literally what it means is the nutrients from the mother to the baby is gonna come in at a slower rate, at a much slower rate. Hypo means low, perfusion means basically penetration. One thing we need to understand about our body and our cells are basically like tiny toddlers, like babies walking around. They want something, they must get it. If they don't get it, they start throwing tantrums. Same thing with our cells. When our cells don't get proper blood supply and proper nutrients, they start throwing tantrum. In this case, they start releasing something called systemic vasoactive compounds. And all of the symptoms I'm about to explain to you regarding preeclampsia happens because of these vasoactive compounds. The first thing they do is they cause something called an exaggerated inflammatory response. That means your blood vessel is going to become swollen, and then they make the blood vessel become very narrow, something called vasoconstriction. And all this will cause something called endothelial damage. That means your blood vessel is not just one tube, it's made up of many tiny cells. These cells are going to become damaged. And when they become damaged, they can't really hold the blood inside properly. So fluid will start seeping out. When this happens near a capillary is a junction between the arteries and the veins. That means we have blood with oxygen, which supplies to the cells and becomes blood without oxygen. The junction between these two is called a capillary. And near this capillary, a lot of leak is going to happen. Fluid is going to start pouring out. And when this happens in the head area, it's going to cause headache, visual disturbance, it's going to have blurred vision. Sometimes even can go to the extent of having blindness. And in very severe cases can cause altered mental state. That means they'll be confused, they won't know where they are. And when this exact process happens near the kidney, that's when you have protein leaking into the urine. As a result, the patient is going to have edema. Edema means swelling. That means the leg's going to be swollen, the back is going to be swollen, the face is going to be puffed up. And when this same process happens in the lungs, they're going to have dyspnea. That means shortness of breath. They can't breathe properly because now there's fluid inside the lung. And when a lot of fluid start leaking out of the blood vessel, they're going to have poor blood circulation, which results in them being weak and lethargic. And when the circulation becomes poor, there's a higher chance of blood coagulating inside the vessels, a condition which is called hypercoagulability. That means the blood will clot at random places for no proper reason. And blood clotting randomly for no reason is something very, very bad for anyone. We can't say for sure who will get preeclampsia and who won't. But then as usual, there are risk factors, which means if you have these certain criteria, the chances of you getting preeclampsia is higher in the list. So what are these risk factors? The first one is age more than 35, being overweight or obese, having diabetes, having chronic hypertension, that means you have hypertension even before you got pregnant, and having family history of preeclampsia. If you find this video to be valuable and you learn anything from this video, the only thing I ask is share it with a friend or family member, spread the knowledge. And until the next informative video, in anything you do, do your best and be the best version of yourself. Bye-bye.